Now we will discuss about autosomal trisomies. Autosomal trisomies are basically extra copy of chromosomes with a normal number. When this extra copy of chromosome occur, it causes many diseases and symptoms. One of these is Down syndrome, that is trisomy 21. Another is Edward syndrome, that is trisomy 18, and third is Patau, that is trisomy 13. Autosomal trisomies are screened in first and second trimesters with non-invasive prenatal test. Incidence of trisomies: Down syndrome 21 is more, its incidence is more than Edwards 18 and Patau 13. Autosomal monosomies are incompatible with life, high chances of recessive trait expression. Down syndrome trisomy 21. It has single palmar crease. Findings of Down syndrome are intellectual disability, flat face, prominent apicanthal folds, single palmar crease, incurved fifth finger, gap between first and second toes, duodenal atresia, Hirschsprung disease, congenital heart disease (AVSD), brush-field spot, whitish spots at the periphery of the iris. It is associated with early onset of Alzheimer's disease. Chromosome 21 codes for amyloid precursor protein, increased risk of AML and ALL. 95% of cases due to meiotic nondisjunction. It is most commonly during meiosis 1. It's increased with advanced maternal age, from 1 in 1500 in females to less than 20 to 1 in 25% in female more than 45. So when females are less than 21, its incidence is low. It's 1 in 1500 females, and above 45 year of age, it is 1 in 25 females. 4% of cases due to unbalanced Robertsonian translocations, most typical between chromosome 14 and 21. So 1% of the cases are due to post-fertilization mitotic error. So how we will remember Down syndrome? So drinking age is 21. So D for Down syndrome and 21 trisomy 21. Most common viable chromosomal disorder. Down syndrome is most common and most common cause of genetic intellectual disability. So when some question asks what is the most common genetic cause of intellectual disability, so answer would be Down syndrome. First trimester ultrasound commonly shows increased nuchal translucency and hypoplastic nasal bone. Markers are high: increased HCG, increased inhibin, increased risk of umbilical hernia. The 6 A's of Down syndrome are atlantoaxial instability, advanced maternal age, atresia, duodenal atresia, enteroventricular defect, Alzheimer's disease, AML less than 5 years of age, ALL more than 5 years of age. So these children, they have Down syndrome. So it is showing a single palmar crease. So it is main sign of Down syndrome. Clenched of fifth finger. So this fifth finger is clenched. It is also sign of Down syndrome. So this is palpebral fissure and flat nasal bridge. This flat nasal bridge is also a sign of Down syndrome. These are nuchal folds at the back. So these nuchal folds are in the Down syndrome. Edward syndrome, trisomy 18. Findings in Edward syndrome, its mnemonic is Prince Edward. P for prominent occiput, R for rocker bottom feet, intellectual disability, non-distinction, clenched fist with overlapping fingers, low set ears, micrognathia, small jaw, congenital heart diseases, for example, ventricular septal defect, omphaloceal, myelomeningocele. Death usually occurs by age 1. In the Edwards syndrome, election age is 18. Second most common autosomal trisomy resulting in live birth. Most common is Down syndrome. In Edwards syndrome, every prenatal screening marker decreases. So this child has Edwards syndrome, overlapping fingers, heart lung abnormalities, club foot, small physical size, decreased muscle tone, low set ears. So these are signs of trisomy 18 or Edwards syndrome, and this child has also same problem. This children also has this Edwards syndrome. So you can see by looking at his feet, his fingers, these both feet are very abnormal position. So these are signs of Edwards syndrome or trisomy 18. Now we will discuss about the Patau syndrome, that is trisomy 13. Findings in Patau syndromes are severe intellectual disability, rocker bottom feet, microophthalmia or very small eyes at birth, microcephaly or very small head, cleft lip and palate. So these are cleft lip. It is very common sign in the Patau syndrome. Holoprosencephaly. It is also present in the Patau syndrome. Polydactyly or multiple finger, cutis aplasia. So this is cutis aplasia at the head. Absence of hair and some skin issues at the top of the skin. It is called as cutis aplasia. Congenital heart diseases, polycystic kidney disease. It is also present in the Patau syndrome. Omphaloceal, and death usually occurs by age 1 in the Patau syndrome. So how we will remember the Patau syndrome? Puberty at age 13. So P for Patau syndrome and 13 for trisomy 13. Defect in infusion of precaudal mesoderm that leads to midline defects. So these are Patau syndrome. Now we will discuss about non-disjunction in meiosis 1 and non-disjunction in meiosis 2. In meiosis 1, non-disjunction, these chromosomes, these homologous chromosomes, they do not get separated, and they both move to the one side of the chromosome, one side of the cell. So trisomy is n plus 1 and monosomy is n minus 1. The gametes are formed in meiosis 2. So the sister chromatids, this is non-disjunction, so they both go to the same side. It is non-disjunction. So normal is n is normal, n minus 1 is monosomy, and n plus 1 is trisomy. So these are at the cellular level during the meiosis 1 and meiosis 2, non-distinction of chromosome at the cellular during the cell division. Now we will discuss about the first trimester screening and second trimester or quadruple screening. First trimester screening, we test beta HCG and PAP-A. So if the level of beta HCG is increased and PAP-A is decreased, So we can assume that there may be some chromosomal problems like trisomy 21 or Down syndrome. In Edwards syndrome or trisomy 18, levels of beta hCG is decreased and level of PAP they are also decreased. And in trisomy 13, beta hCG level is decreased and PAP is increased. So we can say that only beta hCG level is increased in this full table. And in second trimester or quadruple screening, so these we quadruple screen hCG, inhibin A, estriol and AFP. So hCG level is increased, inhibin level is increased, estriol is decreased, AFP is decreased. So we can assume they have Down syndrome or trisomy 21. In Edwards syndrome, hCG level decreased, inhibin A level decreased, estriol decreased, AFP is decreased. So it is in Edwards syndrome. In Patau syndrome, these all levels are normal. hCG, inhibin A, estriol, AFP, these four, and these two, beta hCG and PAP. So we can test these during the pregnancy in the first trimester and in the second trimester quadruple screening.